There's a question that many men, especially those over the age of 60 or 65, often ask themselves in silence. A question that can be hard to bring up even with the doctor they trust the most. And that question is, do the things I do in private have any impact on my health? Is masturbating or having regular sex a good thing or a bad thing? And more importantly, does it have anything to do with prostate cancer? Today, we're going to talk about this openly and honestly without tiptoeing around it as if you were sitting with me in a quiet doctor's office. Because what you do in the privacy of your bedroom, a deeply personal part of your life, can directly affect how long you live and, more importantly, how well you live. I'm a board-certified urologist, and today we're going to uncover what science really says about ejaculation and prostate health, a walnut-sized gland with an outsized role in your well-being. What is the prostate? The prostate is like a small factory located just below your bladder. Its main job is to produce prostatic fluid, a key component of semen. This fluid isn't just a side product. It's packed with nutrients like zinc, citric acid, and enzymes that help nourish and transport sperm. But the prostate doesn't work alone. Semen is the result of teamwork. The seminal vesicles provide the bulk of the semen's volume, a sugary fluid to give sperm energy. Meanwhile, the testicles contribute only about 1% of the volume, but that 1% is the most critical part, the sperm itself. All of these elements come together to form semen, which the body needs to release during ejaculation. So how does that happen? Ejaculation is a complex and fascinating process that happens in two stages. First comes the emission phase, when fluids from the prostate, seminal vesicles, and testicles are delivered into the urethra, like performers waiting behind the curtain before a show. Then comes the expulsion phase. Once there's enough stimulation, the pelvic floor muscles contract forcefully to push the semen out. This perfectly timed dance relies on seamless coordination between the nervous system and your muscles. That's why conditions like diabetes or certain prostate surgeries can interfere with this process. One of the most common questions I get in clinic is, "Doctor, is it harmful to hold it in? Can retaining semen cause problems?" The direct answer is, there's no evidence that not ejaculating causes any serious illness by itself. But that doesn't mean it comes without consequences. Imagine a river that stops flowing, water begins to back up. Something similar can happen in the prostate. In men with chronic prostatitis, a long-term inflammation that can cause pelvic pain, low ejaculation frequency may worsen symptoms due to congestion in the pelvic region. In fact, a study from 1999 showed that increasing the frequency of ejaculation through either sex or masturbation helped many men find relief from these symptoms. It seems that regular ejaculation works like a cleansing mechanism. It clears the ducts, relieves pressure, and reduces inflammation. And there's another benefit that often goes unnoticed: sleep. Ejaculation triggers the release of hormones like prolactin and oxytocin, both of which promote relaxation and make it easier to fall asleep. A recent 2023 study published in the journal Sleep Disorders found that sexual activity, especially when it ends in orgasm, significantly improves both sleep onset and overall sleep quality. So beyond the pleasure, a healthy sex life may actually be one of the best natural sleep aids you have. Does ejaculation help prevent prostate cancer? This is the part many men are waiting for. The issue that raises the most questions and concerns: does infrequent ejaculation increase your risk of prostate cancer? And on the flip side, could frequent ejaculation actually protect you? This question has been the focus of scientific inquiry for decades, and the findings, at least so far, are quite remarkable. The most well-known and extensive study in this area was conducted by Harvard University. They followed nearly 32,000 men over the course of 18 years. And what did they find? Something surprising: men who reported ejaculating 21 or more times per month had up to a 33% lower risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times a month. What's even more interesting is that the method of ejaculation didn't matter whether it was through sexual intercourse or masturbation. The protective effect appears to be tied to the physical act of ejaculation itself, not the specific type of sexual activity. And Harvard's study isn't alone. Other research conducted in later years, including a 2017 study and a major meta-analysis in 2018, confirmed the same trend, higher ejaculation frequency is linked to a lower risk of prostate cancer. That said, as a physician, I must be clear these are observational studies. They rely on self-reported data and memory, which can lead to bias. But the consistency of results across multiple studies makes this link hard to ignore. So the natural question becomes, why? Why might ejaculation protect the prostate? There's no single confirmed explanation, but researchers have proposed 4 main theories. 1. The flushing theory. Think of the prostate as a sponge with many tiny ducts. Over time, potentially harmful substances like environmental toxins or chemicals from smoking can accumulate in prostatic fluid. Each ejaculation is like a flush clearing out these irritants before they have time to damage cells. Without regular release, these compounds may linger and increase the risk of mutations that lead to cancer. 2. Hormonal regulation. Regular ejaculation may help maintain a healthier hormonal balance inside the prostate, stabilizing levels of testosterone and other androgens that influence cell growth. This could help prevent abnormal cell proliferation. 3. Immune system stimulation. A healthy sex life might function like a mild form of physical exercise. It activates the immune system, which doesn't just fight viruses, it also identifies and eliminates abnormal or precancerous cells before they develop into something more serious. 4. Improved circulation and reduced oxidative stress. The muscle contractions during orgasm can enhance blood flow in the pelvic area, reduce local inflammation, and minimize oxidative stress factors strongly linked to cellular aging and tumor development. So how often should you ejaculate per month? After hearing all of this, a common question is, Doctor, so what's the ideal number of times per month I should ejaculate? The honest answer is, there's no one-size-fits-all number. While the Harvard study mentions 21 times per month, that's not a medical prescription. It's not a target that every man should feel obligated to hit. The ideal frequency is personal and depends on a range of factors: your age, overall health, whether you have a partner, your stress levels, emotional well-being, and more. Instead of treating it like a quota, think of it as a health marker. If your body has a natural rhythm, if regular ejaculation helps you feel relaxed, improves your sleep, and lowers your stress, then that might be a sign that your body benefits from maintaining that pattern. On the other hand, if your libido's naturally lower or you're dealing with health challenges that reduce your frequency, that's perfectly okay too. What matters is not the number, it's tuning in to what your body is telling you and not turning sexuality into a source of pressure or guilt. What happens after prostate surgery? Many men worry, if I have prostate surgery, what will happen to my ability to ejaculate and to my sex life? Here it's important to distinguish between 2 types of surgeries because their outcomes are very different. The first is surgery to treat benign prostatic hyperplasia, also known as BPH. This is the most common procedure in older men. Over time, the prostate may enlarge and press against the urethra, making urination difficult. This surgery removes the inner tissue that's causing the blockage but leaves the outer capsule of the prostate intact. The most common side effect of this procedure is retrograde ejaculation, meaning that at the moment of orgasm, semen doesn't come out through the penis, but flows backward into the bladder. This happens because a small muscle valve, the internal sphincter that normally closes during ejaculation, may be affected during surgery. The good news is that orgasm still happens as usual. Erectile function isn't necessarily impacted either. The only difference is that you won't see any semen coming out, it will instead be flushed out harmlessly during urination. As a doctor, I always explain this clearly to patients beforehand so they're not alarmed or disappointed afterward. The second case is more complex surgery to treat prostate cancer called a radical prostatectomy. In this procedure, not only the prostate, but also the seminal vesicles are removed. Once those organs are gone, semen is no longer produced, so ejaculation will no longer occur. That said, orgasm can still happen. This is known as a dry orgasm. The climax can still be felt just without the accompanying fluid. Additionally, this type of surgery carries 2 major risks: urinary incontinence and erectile dysfunction, because the nerves responsible for erections run very close to the prostate and may be damaged during the operation. Fortunately, thanks to advanced robotic techniques, We're now able to preserve most of these nerves, greatly improving the chances of sexual and urinary function recovery after surgery. What's important to remember is that even without semen, your sex life can still be fulfilling and meaningful. Orgasms can still be experienced, emotional intimacy with your partner remains, and there are many therapies, both medical and psychological, to help you maintain confidence and quality of life after surgery. Final message. After everything we've covered, I want you to remember this: there's no magic formula to prevent prostate cancer. No single food, no miracle supplement, and no perfect ejaculation number will guarantee you won't get sick. The most powerful weapon you have is taking proactive control. See your urologist regularly. Get a PSA blood test. It's simple and can detect early signs of cancer. Get a digital rectal exam when advised. Ask about your family history. And most of all, listen to your body. Alongside that, pay attention to factors that science has proven to be crucial. Don't smoke. Maintain a healthy weight. Eat more leafy greens and fewer processed foods. Move your body, especially avoid sitting for too long. And most importantly, stay away from internet quacks promising miracle cures with no evidence. Health is serious, and you deserve information that's honest and backed by science. If you'd like to learn more about PSA testing or how to safely screen for prostate cancer, I've prepared another video on this channel that walks you through the entire process. Thank you for staying with me, for your time and your trust. If this video was helpful to you, please share it with a loved one, or simply like and subscribe to the channel so we can keep making science-based, honest, and compassionate content for men's health. Take control of your health. See you next time.